like it or not. All right? So what we want to do is we want to go back one.
Oh, sorry.
We need to just get on the same page.
Okay.
Evidence-based design. For those of you who do not know this, it is making decisions in the built environment, all right, based on research and clinical outcomes. Now, I'll make it very simple for you. My definition of evidence-based design, make decisions on reality, not perception. It's that simple. Okay? How many people here in this room think shiny is clean? Put your hand up. If you see something that's bright and shiny and you can see your reflection in it, you perceive it as clean. Come on, be honest with me. Put your hand up. Don't use just your perception. You see something shiny, do you perceive it as clean? Most Americans do. Most people in the world do. For people that are well educated, you realize that's not true whatsoever. But trust me, why is everything so shiny in a clinical space in a hospital? Because the patient and visitor's expectation is that it's clean. Their perception is that it's clean. The science says no. There's no correlation between shiny and clean. Evidence-based design talks about that. Now, for those of you that are selling or trying to sell your services to a healthcare purchaser, a healthcare facility, if I was to call you up, Aurora, and I was to say that I'd like to come to introduce myself.
BSI.
Okay. Oh, BSI. BSI calls you up and says, we'd like to come in and introduce you to a revolutionary new product designed for healthcare. This product is designed scientifically to reduce, all right, to improve, I should say, improve your patient experience. Guaranteed to improve your patient experience. Number two, we guarantee you that we can improve your clinical outcomes of your hospital by using this product. And number three, we promise you we will lower your total cost of ownership if you invest in this product. Would you be interested in the product that I just talked about? Of course you would. Those are the three objectives of every CEO of a hospital in America today. They have got to improve the patient experience. Because guess what? Obamacare, whether you like it or not, you're going to get paid, reimbursed, based on the patient experience. You're going to get rated thanks to HCAHPS, and you're going to get paid on a procedure based on how well the patient experience was. Everybody familiar with that? If you're not, we'll talk about it later. All right? The second thing is, you have got to improve your clinical outcomes. Hospital and healthcare are a business, people. I know you don't think about it that way, but they're no different than a restaurant. Well, a little different. When you go to a restaurant, you want a couple of things. At least I do. I eat out pretty much every night of the week with my job. I travel a lot. All I want is a smiling face. I mean, it's that simple. I want someone to come over and serve me that's actually in a good mood. And if you're not in a good mood, don't go to work. Because you're in the service business. Just like in a hospital. I don't want an obnoxious caregiver. I don't want an arrogant doctor. I want a human being that understands that I'm in pain or I'm suffering, right? Number two, all right, you need to make sure that you're giving a good service, meaning that you are healing people correctly. So they're walking in with tonsillitis and they're not staying for 6 weeks with MRSA. All right? They're walking in with tonsillitis, they're getting healed, and they're leaving, or C. diff, or whatever else, or a staph infection. That's your clinical output. You've got to improve that. You have got to do a good job of getting them healed and getting them out, and turning your rooms over. It's no different than a restaurant. You need to turn the tables over. A hospital needs to keep those rooms occupied. I hate to say it. I mean, nobody wants people to be sick, but hospitals do. That's how they stay in business. But they want to cure you and get you out. And number three, that always is discussed. I had the pleasure of talking to many CEOs of hospitals. Never had that chance when I was in Renee's role. There wasn't a CEO in America that would give me 5 minutes as a carpet rep. Wouldn't even answer my phone call, right? It's sad. But now that I'm in this role, and I call them up and talk about improving their clinical outcome, improving their patient experience, and lowering their cost of ownership, they line up to talk to me. What are you doing? What do you got that will do all that? Now, flooring plays a small role in that. It's not just the flooring that's going to solve all these problems. But let me show you how flooring does help you get those three things. All right? So, number one, this is where you start looking at your flooring specifications for healthcare and the little checklist that I've got in front of you. That you start putting a check next to, can my flooring do this or can't it? This is a very simple process. There's no gray area here. I'm going to be very black and white with you. I'm going to be very blunt, you probably figured out already, and very honest. You might not like what I say, you might not agree with what I say, but I promise you it is 100% factual and scientific based. It's not my opinion. I can give you my opinion later if you want to stick around, but today is all about the facts. Are volatile organic compounds good or bad?
Bad.
Oh, good. I'm glad. Okay. Yes, they're bad. Okay. Anybody buy a new car lately? New car? Anybody in the last year or two buy a new car? Wow, times are really tough. Anybody in the last 5 years buy a new car?
Yeah.
Okay, now what was the most exciting thing about your new car besides the smell? Now let me explain something to you. You are crazy if you are breathing inside a brand new car.
Yeah.
Those are volatile organic compounds, formaldehyde and solvents and things that are coming off of all the plastic and all the vinyl and all the leather that's in your car. And it's not healthy stuff. There should be a big, you know when you flip down your visor, it says, you know, put airbag, don't put a kid here, or make sure you wear your seatbelt because the airbag will blow up in your face and kill you. There should be another big sticker when you buy a car. Do not drive this with the windows up for the first 6 months. I'm sorry if you live in Milwaukee and you bought your car in the winter. You don't want to be breathing that stuff. So organic compounds, volatile ones, are not good for the indoor environment. We know that. LEED tells us that, right? Everybody understands that. So when you're looking at flooring, the first thing you should ask yourself is what are the volatile organic compounds, the VOCs that are emitted from the product and also the installation process, the adhesives that might be used, the sealers, all the things. How about the topical wax that you're putting on top of your floors? All those things should be looked at. Number two, are respiratory contaminants good or bad? Bad. Okay, especially for hyperallergenic people, people with asthma. How many people here get like watery eyes, itchy eyes, and headaches and all that, like during pollen season and all that? Anybody here that's got those allergies? Okay, so you know what I'm talking about. You hate that time of year, right? It's a beautiful time of year. It's spring, it's rebirth, but you're like, oh my God, the pollen is killing. Yeah, she cries a lot. Did you hear that? All right, how about microbial growth? Is that a good thing in hospitals? All right, so let's look at what we need to do. All right, how do we limit? I can never say the word eliminate, because that's up to your environmental services, Steve. But how can I put a floor covering down that's going to greatly help your staff keep the product clean and safe? What do you need to do in the floor covering? The number one thing you better ask your client that you're looking at, the number one thing in healthcare flooring is my product, your product, impermeable? End of story. It's a yes or no. Does moisture penetrate or pass through my product? That's all I want to know. If I spill something on this product, where is the moisture going? Now, let me show you how carpet does when we talk about healthcare. Now, ugly, I know, okay? Just bear with me. This is the lowest brand, the lowest category of carpet that you can buy. You can go to Home Depot and get this for $1.99 a yard, all right? I'm just using it as an example. I know none of you would ever specify, but trust me, there was thousands of yards of this installed in hospitals in the 80s. I actually put some of it in, all right? Because back in the 80s, we decided to make our hospitals more home-like, right? Make them safer, warmer, more comfortable. All those things our patients wanted, but we went to the wrong products. And we put down broadloom carpet. And what happens when you spill something on broadloom carpet? You probably don't even know, but 8 ounces of red liquid was spilled on this product. It was allowed to sit there for 24 hours. After 24 hours, where is the red liquid? It's in the backing, through the backing, in the subfloor, gone. You cannot clean what you cannot see in healthcare. This is a microbial nightmare. This is a petri dish. Okay? So we're going to throw that out. By the way, Candace Flooring, we manufacture broadloom carpet every day of our life. I'm giving you the truth. This is not about me. All right? Now, there's products out there that are called performance back carpet. You saw it earlier in the categories. There's actually moisture barrier back carpet that you can buy. Right? We actually make one as well. It's a product called Lifelong, and it is a moisture barrier. But there's a certain thing about moisture barrier back carpet that manufacturers don't like to talk about, is that the products are only moisture barrier in the body of the product. Where do you think they fail? Okay? This is a moisture barrier back carpet that passes the British spill test. So you as a specifier think you've specified something that's suitable for healthcare, and you forgot about the seam. Now, this might very well have a moisture barrier back on it. I doubt it does, but let's say it did. They did a beautiful thing here. Put a border in, put another coordinating color, because this is what you do in design to make floors pretty, right? That is a nightmare in healthcare, because now you've got an open seam that moisture can penetrate in your entire product. Everywhere the doorway is, everywhere there's a seam, everywhere you cut the product, every inset you put in, all right? Now how about carpet tile? Who here believes that carpet tile is a better solution than broadloom carpet? My hand's up, this is for real. Okay, by definition, carpet tile is a better designed and constructed product than most broadlooms. The way carpet tile is manufactured, the way the pile is brought down tighter and denser, the backing systems that are used, whether it's EVA, whether it's PVC, whether it's PVB, whether it's EchoWorks, whether it's whatever brand you're using, Carpet tile backings are, by definition, superior to most broadloom backings. Tom, do you agree?
Yes, sir.
So carpet tile structurally is a better product.